Okay, now the next topic is differentiating cardiac catheterization versus coronary angiography versus PTCA or PTCA with stenting. So yung iba, they could use these terms interchangeably or medyo nako-confused ba sila because these procedures are almost similar to each other. So what are the differences of these procedures? Let's first talk about cardiac catheterization. So what is cardiac catheterization? So in here, you can see that I wrote here, it can be used for both diagnostic and therapeutic purposes. So when you say diagnostic purposes, ibig sabihin yan, ginagamit ito to detect or confirm the presence of a disease or a disorder. Yun po si diagnostic purpose. But when you say therapeutic purpose, this is used, okay, to treat or relieve signs and symptoms caused by a particular disorder or disease. So yun po, your cardiac catheterization can be used for both diagnostic and therapeutic purposes. Now, how is cardiac catheterization being done? So in a cardiac catheterization, okay, merong insertion ng needle. Okay, and then from that needle, magi-insert ng guide wire. And then, the final thread, okay, merong ipapasok na catheter from that, okay, using that guide wire. Okay, merong catheter na i-insert and this catheter will be inserted from the arteries of the body. Ano mga ang primary sites for insertion? What are the primary sites for insertion? You have femoral artery. Okay, where is the femoral artery located? This is located at the patient's groin or nasa singit. What else? Paano pag hindi patent or hindi pwedeng gamitin sa femoral artery? We can use the brachial or radial artery. So these are the common insertion sites. Dito pinapasok yung mismong catheter, and these catheters, they are threaded, okay, or they are inserted until it reaches the patient's heart. Okay, so this is an image. Okay, so ipapasok yung catheter hanggang makaabot siya sa heart ng patient. So that is cardiac catheterization. The insertion of a catheter from the artery, whether femoral, brachial, or radial artery until it reaches the heart, both for diagnostic or therapeutic purposes. So pag sinabi kasi natin cardiac catheterization, this is a very broad, okay, very broad procedure. And under cardiac catheterization, doon natin pwedeng gawin itong coronary angiography versus PTCA or PTCA with stenting. Lahat ng mga yan, they are done using cardiac catheterization. Sila yung mga example ng diagnostic and therapeutic purposes ng cardiac catheterization. Now, paano? Okay, or let's first talk about the two general types of cardiac catheterization. There are two general types of cardiac catheterization. You have, pretty self-explanatory to, you have left heart cardiac catheterization and right heart catheterization. So in a left heart cardiac catheterization, okay, the catheter will be threaded or inserted using an artery. Bakit artery ang ginagamit? Kasi yung artery, this leads back, okay, into the left side of the heart. Tama? Yung artery. Okay, si artery, this leads back to the left side of the heart. And kapag naman right, okay, you have the use of veins because the veins go towards the right side of the heart. Okay, pag confusing pa rin, let's go back to the basic anatomy and physiology of the heart, including the blood flow. Okay, so for example, this is the heart. Okay, this is your superior and inferior vena cava, and then this is your aorta. Okay, hindi ko na drawing lahat ng parte ng heart. Okay, but anyway, okay, and then, sorry. Okay, and then let's draw the different chambers of the heart. Okay, so this is the, okay, let's draw the different chambers of the heart. Okay, so si atria nasa taas. And then you have the ventricles below. Okay, now let's talk about the basic na blood flow. Okay, so we have yung tinatawag nating systemic circulation. When you say systemic circulation, this basically means yung pag-ikot ng dugo sa buong katawan ng isang tao. That is systemic circulation. Now, if the blood came from systemic circulation, ibig sabihin galing na siya, nag-circulate na siya sa buong katawan, it has to go back into the heart. Bakit? The blood that came from systemic circulation is already deoxygenated. Ibig sabihin, gamit na yung oxygen na dala-dala ng blood na yan. Kasi yung blood na yan, this has already came. Okay, nagamit na siya ng buong katawan. Tapos na siya sa systemic circulation. So, wala sang oxygen. So, this blood has to be oxygenated. Kailangan makakuha siya ng oxygen. So, paano mangyayari yon? This blood will go through the veins. And ano yung pinaka-major na veins natin? You have superior and inferior vena cava. Okay, and then from the superior and inferior vena cava, papasok yan sa right side ng heart, which is the right atrium. Okay, that is why si veins ang ginagamit for right heart catheter. Naku ha, right heart catheterization. And then, from the right atrium, bababayan kay right ventricle. And then, from the right ventricle, dadaan yan kay pulmonary artery. Okay? Pulmonary artery. And from the pulmonary artery, pupunta siya kay lungs. Okay? And then, doon siya sa lungs kukuha ng oxygen. Kasi originally, it is deoxygenated. So, pag napunta siya sa lungs, pwede na siyang mag-pick up ng oxygen doon sa lungs. And, kapag oxygenated na siya, ibig sabihin, nakakuha na siya ng oxygen, it has to go back into the heart. Okay, this is for imaging purposes. Okay, ngayon, ito may oxygen na siya. So, it has to go back to the heart. Dadaan siya kay pulmonary vein. Okay? And then, it will go to your left atrium, and then down to the left ventricle, and then up. Okay, sa pinaka-major artery natin, which is the aorta. Okay? C artery. Okay, from the left ventricle, this will move to the arteries. And pinakaunang artery dyan is the aorta. Okay, and then from the aorta, it will go back into systemic circulation using arteries. Kaya artery ang ginagamit kay left side because yung right side natin, okay, ang type ng blood vessel na nagdadala ng deoxygenated or dugo na walang oxygen papunta sa heart are veins. Okay? And ang dugo na walang oxygen pupunta siya sa right side ng heart. Kaya veins ang ginagamit for right heart catheterization. And, okay, yung dugo that came from the left side of the heart will go to the body using arteries. Kaya, arteries ang ginagamit for left heart catheterization. Now, the patient preparation or care for patients will be discussed pagpunta natin dito sa mga coronary angiography, Ptca with stenting, or Ptca. Okay? Kasi these are all under cardiac catheterization. So first, let's talk about coronary angiography. Okay, let's first talk about coronary angiography. Okay, what is coronary angiography? In coronary angiography, okay, ginagamit ulit natin si cardiac catheterization or we insert a catheter into the patient's body using those primary sites or yung mga primary artery na na-identify natin kanina to visualize the heart's blood vessels, okay? Blood vessels. Usually, the arteries. Okay, you have coronary angiography. Visualize or tinitignan yung blood vessels ng artery using cardiac catheterization. So, what is the difference of cardiac catheterization with coronary angiography? In coronary angiography, there is the use of a contrast dye. Contrast dye plus X-ray. Because coronary angiography is a specialized X-ray procedure. So, ano nangyayari dito? Okay, mag-i-insert ng catheter sa femoral artery hanggang makaabot siya sa blood vessels ng heart. And then, inside that catheter, mag-i-introduce or lalagyan yan ng contrast dye. For what reason? Yung contrast dye, this provides better visualization. Paano? Ano ba ang nakikita nating kulay ng X-ray? Diba X-ray is produced in black and white? Pag tumingin tayo ng results ng X-ray, usually black and white. Now, okay, yung contrast dye, parang ang nangyayari dyan, kinukulayan niya yung blood vessels ng puti. Okay? Para mas maging pronounced or mas emphasized yung itsura ng structures na yon pagdating sa X-ray. So, for example, pag ito yung artery, okay, na walang contrast dye, pag nilagyan mo yun ng contrast dye, let's just imagine na putito ha, kasi putitong background. So, for example, okay, pag tinignan mo yan sa X-ray, very emphasized itong part na to. Kulay na kulay siya, very visible. Okay, so this, ang function yan, contrast dye is for better visualization. And then, this will produce X-ray images. Now, what is the patient preparation for coronary angiography? Number one, of course, kapag invasive procedure, lagi, always remember, if the procedure is invasive, meaning it requires entry inside of the patient's body, we have to make sure there is informed consent or pumirma ng consent ang pasyente. Are we the one that will make that patient sign the informed consent? No po. Kung sino yung doktor na magper-perform ng coronary angiography, siya yung magpapasign ng informed consent. So what is our function as nurses? Our function here is as witness. Okay, tayo ang witness and we also serve as patient advocate. Anong ibig sabihin ng patient advocate? Ibig sabihin nito, when you are an advocate, you stand for the patient's rights. Okay, sinisiguro natin na kung ano yung mga karapatan ng pasyente natin is nare-respeto at naa-uphold siya. So if we see something that violates the patient's rights, we have to stand up against that. We have to speak for the patient. Okay, we have to help or make sure na yung mga karapatan ng pasyenteng yan, they are respected and they are protected. So yun ang function natin when it comes to informed consents. Next, very important, allergy. Okay, presence of allergies. Allergy saan? Iodine, because yung contrast dye na ginagamit natin has iodine, or majority of this has iodine. Okay, a lot of that content is made up of iodine. Okay, now paano natin malalaman or tatanungin sa isang ordinaryong patient if they have allergy to iodine? You have to ask them if they had reactions to seafoods. Seafoods, bakit? Seafoods, isipin na lang ninyo, seafood maalat. Okay, para hindi niya siya makalimutan. Seafoods are the major source or a rich source for iodine. What else? Iodized salt. Okay, tanongin niyo sila if they have allergies to these particular foods or nagkaroon na sila ng reaction before. Bakit? Iniiwasan natin na magkaroon ng allergic reaction ng patient natin during the procedure. Because what is the worst thing that can happen pag nagkaroon ng allergic reaction ng patient? It could lead to a severe allergic reaction. Anong tawag natin sa severe allergic reaction na yan? Anaphylaxis. Pwede ba niyang ikamatay yan? Yes. Your anaphylaxis can lead to anaphylactic shock. Dahil sa severe allergic reaction, okay, pwedeng magkaroon ng problema sa circulation or pagdaloy or supply ng dugo sa major organs ng pasyente. Okay, this could be done on a separate discussion, but it could lead to anaphylactic shock. Next, you have medications. Anong klase ng medications? Okay, yung ating mga anticoagulants or thrombolytics. Okay, anticoagulants or thrombolytics. Anong difference nilang dalawa? Pag sinabi nating anticoagulants, kinokontra niya ang coagulation. Ano bang ibig sabihin ng coagulation? Blood clotting. Blood clotting. Okay, it is preventing, okay, the blood from clotting, okay? Tawag din natin sa kanila blood thinners, okay? They make the blood thin, okay, or less viscous, less malapot, parang ganun, mas runny, okay? Anticoagulants, they prevent blood clotting or reduce blood clotting. Or thrombolytics, ano naman ang thrombolytics? They dissolve existing blood clots. So ano ngayon ang problema if the patients are taking or may history sila ng pag-take ng mga ganitong klase ng gamot? This can cause the patient to become a bleeder. Okay, pwedeng magdugo ang patient or they could lead to major bleeding during the procedure. Ano yung mga example natin ng mga medications na anticoagulants? You have aspirin, heparin, and warfarin. Ito yung mga commonly taken anticoagulants. Okay, you have to make sure na na-check natin yan. And usually, patients are put on a diet NPO. Okay, NPO, ibig sabihin ng NPO, nothing per orem, or the patient should not consume anything by mouth. Okay, by mouth during the or before the procedure. A couple of hours before the procedure. Usually, 6 to 8 hours or 4 to 6 hours prior to the procedure, naka-NPO na si patient. So, ibig sabihin, walang kahit anong isusubo ang pasyente orally sa bunganga nila. Okay, food, ke water, no, nothing per orem. So, wala. Okay, so those are the usual cares that we do for the patient. And of course, after, okay, post-procedure, we have to make sure that the patient, okay, avoids moving affected limb. Ano bang ibig sabihin ng limb? Okay, yung extremity na ginamit. For example, we use the femoral artery. Saan ba ito nakalagay? Sa singit. So for example, naka-femoral artery, the patient is not allowed to move the leg, okay, for a couple of hours after the procedure. Hindi niya pwedeng i-bend, hindi niya pwedeng igalaw-galaw, iikot-ikot. Bakit? Pwedeng mas lalong matroma yung puncture site kung saan tinusukan yung patient at pwedeng mag-delay ng healing. 'Di ba? Isipin mo na lang, tinusok ka sa artery tapos ginalaw mo ng ginalaw yan. Possible na mag-lead into more trauma, more bleeding, delayed wound healing. At pwede pang magkaroon ng problema sa circulation or pagdaloy ng dugo because of that. Okay? So, hindi pwedeng igalaw ng igalaw. And then, we have to put pressure. Okay? Dapat may pressure doon sa puncture site or kung saan tinusok si patient to promote, okay, clotting or prevent bleeding. Okay? Para magtigil yung pagbe-bleed. Okay? We have to put pressure on the area. So, ito yung mga importante when it comes to coronary angiography. Now, let's go back to Ptca. Okay? Ptca. Or, ano bang ibig sabihin ng Ptca? Your Ptca means percutaneous transluminal coronary angioplasty. So, anong ginagawa dito? So, what happens in your PTCA is, simple lang yan, okay? During cardiac catheterization, pag may nakita, okay, na blockage sa artery, for example, ito, si atherosclerosis. Nasaan ba si atherosclerosis? Okay, in the previous discussion, okay, pag merong atherosclerosis, ibig sabihin, pag merong blood vessel na binarahan ng cholesterol or other fatty substances at nakita yan sa cardiac catheterization mo, pwedeng mag-perform ng PTCA. So, what is PTCA? In PTCA, magi-insert ng catheter. Di ba meron na tayong catheter na in-insert? Okay? In that catheter, pwedeng gumamit ng balloon, okay, or balloon in a catheter. So, merong balloon dyan sa catheter na yan. So, anong ginagawa ng balloon na yan? Okay, that balloon will be inflated. Okay? Ini-inflate yung balloon na yan. Or pinapalobo. Okay? For what? Bakit siya pinapalobo? Okay? Pinapalobo yan to flatten. Okay? Para ma-flatten yung fatty deposit sa gilid ng arteries. Para saan? Para mapaganda ulit ang daloy ng dugo. Kasi pag masikip yan, mahirap dumaloy ang dugo. So in PTCA or percutaneous transluminal coronary angioplasty, merong balloon. Yung balloon na yan, papalobohin or i-inflate doon sa area na merong atherosclerosis or okay, namuo ng mga fats at other substances sa blood vessel, iipitin yan, pipit-pitin siya, okay, para lumuwag yung area. Pwede siyang, hindi lang siya necessarily isang beses i-inflate. I-inflate yan ng i-inflate ng paulit-ulit hanggang sa mag-flatten siya. And what is the difference of PTCA and PTCA with stenting? Pag sinabi natin PTCA with stenting, okay, after ma-inflate ng balloon, ma-flatten, okay, nung fatty substances, pwede dyan mag-iwan ng, okay, stent. Okay? Iiwan na dyan yung stent. Okay? And that stent will keep, okay, it will keep that blood vessel open. It will keep that blood vessel open. So, magiging itsura niyan, okay, ito si blood vessel, may iwan yung, let's just say that there is still minimal, okay, minimal dyan sa gilid. Okay, the stent will be left here, okay, to keep this area open. Okay, naka-open na lang siya. Para hindi na ulit magsara or hindi na ulit sumikip with that fatty deposit. So, this is PTCA with stenting. Okay, iiwan siya dyan ng stent. So, that's it for cardiac catheterization, coronary angiography, and PTCA or PTCA with stenting.